114%. Yeah, let that sink in for a second. What you're looking at here, this isn't some worst-case scenario for a handful of people. Nope. This is the average premium increase for more than 20 million Americans in the Affordable Care Act program. Their bills more than doubled from one day to the next. So the big question is, right, how does a price hike of this magnitude just happen all at once? Well, the answer lies in the expiration of a really critical but also temporary piece of government support. And in this explainer, we're going to break down exactly what that support was, who it was helping, and why it suddenly vanished.
All right, so first things first, let's just look at the what. What exactly was this program that was, propping up the health insurance market for so many people?
The easiest way to think about it is like a giant nationwide coupon for health insurance. These enhanced ACA subsidies were first created back in 2021 to help folks get through the pandemic. And they worked by basically capping how much of your income you had to spend on your monthly premium. For some people, that meant their premiums dropped to zero. For a lot of others, it was the key that finally unlocked a really good plan that had always been just a little too expensive. But like any coupon, this one had an expiration date. And on January 1st, 2026, it just ran out. And when you look at who was using this coupon, you realize this wasn't some niche little program. No way. This was a lifeline for a huge slice of the American workforce. We're talking freelancers, farmers, small business owners, and crucially, it also helped a ton of middle-class families. The ones who were kind of stuck in the middle, earning too much for other programs, but not getting insurance through a job. Okay, so that's the 30,000-foot view. But to really, really understand the impact, we have to zoom in from that national level right down to the kitchen table. This is what it sounds like on the ground. This quote, it's from Caitlin Provost, a 37-year-old single mom and a social worker. And her words, man, they just capture this frustration that was felt all across the country as families were suddenly staring down these impossible budget choices. And if you think that's just words, look at the cold, hard numbers that back it up. Before those subsidies expired, Caitlin's monthly premium was a totally manageable $85. Afterwards, it jumped to almost $750 a month. That's not an increase you can just absorb by, cutting back on lattes. That is a full-blown financial crisis for a family. And believe it or not, Caitlin's story isn't an outlier. In some cases, the jump was even more extreme. Just listen to Alex Flores from Brownsville, Texas. His monthly premium went up 23 times what he was paying before. The financial whiplash for families was it was severe and it was immediate. So what do you do when you're faced with a bill like that? What would you do? For so many parents like Caitlin Provost, the answer was just a heartbreaking calculation. She actually planned to drop her own health insurance completely, just so she could afford to keep her 4-year-old daughter covered. Which leads us to the next very logical question. How on earth was something so critical just allowed to expire? The answer, it turns out, lies in a series of legislative decisions and, in the end, a political deadlock. So let's kind of trace the path to this cliff edge. It all started back in 2021, a temporary relief measure for the pandemic. But they were so popular that in 2022, they got extended for another 3 years. The thing is, that was really just kicking the can down the road. When that new deadline rolled around in December of 2025, Congress was deadlocked. They couldn't agree on another extension. And so, the program just ended. The clock ran out. So here's a quick look at what that deadlock looked like in the Senate. On one side, Democrats proposed a pretty straightforward plan, just extend the subsidies for another 3 years. On the other side, the Republican alternative was focused on creating new health savings accounts, or HSAs. It's a different philosophy, right? Giving money directly to people to manage their own healthcare costs. With two fundamentally different approaches on the table, neither one could get the 60 votes needed to pass. And that was it. The path forward was closed.
So the subsidies expired. What does that actually mean for the country as a whole? Well, the consequences start to ripple far, far beyond individual households.
Let's talk numbers. The Congressional Budget Office, they're the official nonpartisan scorekeepers in D.C. They ran the numbers, and their projection is pretty stark. They estimated that out of the 24 million people who relied on these plans, about 4 million would lose their health coverage completely in 2026. Why? Simply because they couldn't afford it anymore. And that loss of coverage, it creates this huge domino effect across the whole economy. One analysis projected a potential $57 billion hit to our national economic output, and the loss of nearly 300,000 jobs. And get this, a huge chunk of those lost jobs, about 130,000 of them,
were expected to come from the healthcare sector itself. At the very same time, hospitals are bracing for a surge in what's called uncompensated care. That's when more and more people show up at the ER without any insurance.
So with no federal solution on the table, the focus has now completely shifted to the states, and they are scrambling to respond in a whole bunch of different ways. What we're seeing emerge is this patchwork of solutions. You've got New Mexico, the only state so far to say, you know what, we're just going to fully replace the federal money. Then you have states like California and Maryland that are targeting relief, focusing on their lowest income residents. And other places like Colorado and Connecticut have committed big chunks of money to just try and keep their markets from going haywire. The result, though, is a really uneven state-by-state safety. And this whole situation leaves us with a really critical question about the future. We just watched millions of people lose their access to affordable health insurance because a temporary federal program ended. And now, in its place, some states are building their own little life rafts. And it forces us to ask, is this fragmented state-by-state approach the new reality for America's healthcare safety net? Is your ability to get affordable care now going to depend entirely on which side of a state line you happen to live on?